Hi, Miss McCracken. It's Wally, your student nurse. I'm gonna go ahead and clean my hands here real quick here. I'm gonna close the curtain for some privacy. All right, Miss McCracken. So can I have you verify your full name and your birthday? Oh, okay, Phyllis McCracken, 317 XXXX, great. Dr. Killjoy is your doctor, correct? Okay. So I understand that you're having like some bloating in your belly. Yeah, so I'm gonna do a couple of things here, or a few things, Miss McCracken. I'm gonna, actually, I was also informed that you're having some trouble, no, I'm sorry, not trouble breathing, some discomfort in your belly, right? Yeah, okay. So I'm gonna go ahead and do a quick assessment of your belly. And then doctor ordered for me to put in an NG tube. It's a nasogastric tube that goes in through your nostril, and then it goes down through your throat into your belly. And then we hook that up to suction, and it helps eliminate some of that content in your belly that isn't coming out properly. Just hopefully give you some relief with that distension and uncomfortability, okay? Good. Okay, and then, additionally, what I'm gonna be doing is I'm also gonna be checking your IV site in a little bit and kind of also listening to your lungs. It's part of the assessment that we do when anyone has an IV going, just to make sure that you're not getting too much fluid into your system. And in correlation with that, I'm also gonna take a look at your legs for some edema, okay? All right, well, let's get started. The first thing I'm gonna go ahead and do is I'm gonna go ahead and listen to your belly, palpate real quick, and then we're gonna put that NG tube in, okay? It's a little bit of uncomfortable a little bit of an uncomfortable feeling, but I'll do it as quickly as I can and safely, okay? So I'm gonna go ahead and actually clean my hands again, put on some gloves, and then take a quick look at that belly. What's that? No, it's uncomfortable, but it shouldn't be painful. Okay, but we'll do the best we can, okay? All right, so I am gonna go ahead and bring the bed up just a little bit. Good. I'm gonna bring the side rail down just so that I can work a little easier. And I'm gonna go ahead and take a look here. Cover you up. All right, I do see the dressing there, so I'm not gonna push too much there. Just take a quick listen, okay? And I'm listening in all four quadrants, skin to skin. Good. Good. Bowel sounds are present, and I do see a little bit of bloating there. Do you have any pain here? Just discomfort, yeah. I'm not pressing over the incision. I don't want to cause any pain there, and I do feel the bloating. Okay, so let's go ahead and get that NG tube in, okay? I'm gonna go ahead and, while you're laying there, I'm gonna take just a quick look at your nostrils here. Just make sure there's no irritation, that there's no blockage, and it looked clear and open to me, no bleeding, skin's intact. And then what I'd like for you to do is I'm gonna press here and take a deep breath. Good, one more time. Good, all right, so it looks like you can breathe easier to the right side, is that correct? Good, okay. So I'm gonna go ahead and, actually, you know what I'm gonna do really quick, Mr. Kraken, if it's okay with you, I'm gonna go ahead and bring your head up. And I'm gonna just listen to your lungs right now before I put that tube in, okay? I'm gonna have to do that anyways. I figured it might be better if we do it before we put the tube in your nose. Okay. Is that okay? Yeah? Okay, good. Okay. So I'm just gonna take a quick listen here. And I'm listening to your lung sound, skin to skin here. Take that up there. All right. So I'm taking a listen. Good. The basis here. Good. All right, lung sounds are clear. So I'm gonna bring you up just a little bit here, and I'm gonna listen to your lung sounds in the back. Okay. Take a deep breath. Good. 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 Very good. Lung sounds are clear, no crackles, everything sounds good in there, so that's always a good thing. All right, Miss McCracken. So I'm actually going to go ahead and I'm gonna have my technician grab me a blue chucks from the thing there. And I'm gonna place that over your chest, okay? Belen, could you please grab me a blue chucks? Thank you. Okay. All right, so this will be part for the NG insertion, okay? All right. I'm gonna check the suction real quick. Make sure that this is working. Yep, suction is working well. Good. I'm gonna put this here so that we put the NG tube in. All right. Let me clean my hands and get some gloves on. All right, Miss McCracken. So what I am going to do is I'm going to put this blue chucks over your chest area so that we don't get your gown dirty. My technician, Belen, will help me. Once that tube reaches the back and it feels a little uncomfortable, they're like pushing against, I'm gonna ask you to swallow. That swallowing motion is gonna help that tube facilitate down through your throat into your belly, okay? Initially, we're gonna have you put your head back against the pillow, just like that, to kind of help me ease that tube in. And then I'm gonna have you bring your chin to your chest. And that's when you'll swallow, okay, Miss McCracken? All right. So I'm just gonna bring this over on your chest there. I'm gonna kind of sit you up just a little bit more. Kind of 45-degree angle there, okay? Okay, all right. Bring this over. My lubricant. All right, so first thing I'm gonna do is just measure. So I'm measuring from the tip of your nose through your tracheus here in the ear, and then we're gonna measure down to the xiphoid process. So it's reaching about 45. There, we're gonna mark that with some tape, and that's gonna let me know how far to advance the tube in, okay? So I'm marking that there. All right, Miss McCracken, gonna get some lubricant here. I have my safety pin because I'm actually gonna anchor this to your gown. All right, some lubricant. Okay, Miss McCracken, head against the pillow. All right, and we're gonna go on your right side, okay? Deep breath, deep breath. Okay, you feel that? Chin, okay, go ahead and swallow. Swallow, swallow. Okay, almost there. Swallow, swallow, yep, there we go. All right, we're done. Let me anchor this here, okay? We're gonna secure the tube so that it doesn't dislodge. Just like that. And then we're gonna come around. I'm sorry, my dear. Okay, there we go. That secures the nasogastric tube to your nose. Yeah, that was unpleasant. I know, I'm so sorry. You know, so what I would like to do now is I'm going to check placement of that. I'm gonna move this to the side. And I'm just gonna aspirate here and see if I get stomach content come out. Oh yeah, look at that, that's stomach content there, and I'm gonna put that right back in there. So that lets me know that the tube is in place. The other way we can check is if doctor wants to order an x-ray, we can also shoot an x-ray to make sure placement of that, okay? So I'm going to take this off. I'm gonna clip this to your gown. And this will secure that in place. This is always staying up. We don't want that to leak. And then, you know, I'm gonna, Belen, would you be so kind as to grab me some tape from that little emesis basin that's on the, right up on that one, by the black bottle. Behind that little bin, there's some tape in there. I'm gonna tape this to your cheek here, okay, Miss McCracken? Also breathes you. Thank you so much. Yep. Oh look, I had brought some tape and I have it behind me. Silly me. It's been a busy day. All right, Miss McCracken, I'm gonna just tape this, give you some wiggle room. I don't want it to accidentally yank, so I'm giving you some room there. This tape is hypoallergenic and that's gonna secure that there. I'm gonna hook this up to suction. We're gonna put this on continuous suction per the doctor's orders. Oh yeah, look at that. How does that feel? Much better? Good, okay. So you know what I would like to do now, Miss McCracken, is actually just take a look at your belly again, okay? So I'm gonna move this all out. Going to throw this in the garbage. All right, let's bring this side rail up. I'm gonna lay you back here. Let me know if it's uncomfortable. Just wanna take a quick listen to your belly here. Doing okay so far? Is that okay? Good, okay. Clean my hands. I'm just gonna take a quick look here. Oh yeah, the belly is definitely looking much better, less bloated there, right? Are you feeling better? Good. All right. Just gonna take a quick listen here for some bowel sounds. Skin to skin. Good. Bowel sounds are present. It looks less distended. Does that feel better? No pain? Less pressure? Good. No pain? Good. All right, Miss McCracken. So here is your call light. Are you comfortable in this position here? Okay, good. Let me just bring the bed down though. I'll leave you sitting up in that position, but we'll bring the bed down for safety. Here is your call light. Where did that call light go? Oh. Yep. Here's your call light. If you need anything, you press that and give me a call, okay? All right. I'm gonna go check on some orders here and I'll be back shortly. Hi, Miss McCracken, I'm back. Wally, your student nurse. So I understand doctor has stopped the suction. I'm just gonna do a quick irrigation of that NG tube, okay? And then we're gonna check your IV. So let me turn off this suction here. We're gonna unhook that. Cover that so we don't leak. All right. Okay. Just a quick irrigation. Some saline here. We're going to do 60 cc's of normal saline. Normal saline. And I see your abdomen. Yeah, I do see. I'm going to lower your head a little bit here. It's a little bit more bloated there, but let's take a quick listen and feel, okay? And then we're going to irrigate that, make sure it's still in place. Good. Little bloated, no pain. Good. Okay. So let's go ahead and irrigate that NG tube here. So we've got 60 cc's of normal saline. We're going to irrigate here. Yeah, it's a little cold, sorry. That went in smoothly. Oh yeah, we got contents, that's great. All right. So that appears to be in place. We're gonna leave that there. Quick reassessment. Still looks good. All right, I'm gonna just walk around and take a look at your IV, okay? We listened to your lungs, which were great. There was no swelling in your feet. I would like to check one more thing here, Ms. McCracken, real quick. And that's just take these gloves off. I just wanna feel your pulses real quick here. Yep. All right, Ms. McCracken. pulses are present. Let me check the other side. Good. Okay. I'm going to just grab some gloves and check that IV real quick. All right. Let me take a look here. So we have the right medication. It's not expired. Oh, it was just started, so it's good to go. It's running at 42. Do you have any pain in your IV site? No pain? Let me use one hand. No pain? Good. Looks no swelling, no redness, no edema. The tubing is clear of kinks and air. The fluid is running good. And then skin to skin, temperature is normal. All right, Ms. McCracken, everything looks good. Here is your call light. I'm gonna position you. Are you comfortable sitting in that position there? Good. All right, I'm actually gonna bring the bed down for safety here. Oop, wrong one, sorry. All right, bed is down. And if you need anything, you call me, okay?